South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family. Greetings and welcome to our latest Let's Talk Your Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS, thank you for joining us. It's general knowledge. Good health is essential to leading a fulfilling and meaningful life. By prioritizing physical, mental, and social well-being, individuals can improve their overall health, reduce their risk of chronic diseases, and enhance their overall quality of life. So to help Rio Grande Valley residents prioritize their health, South Texas Health System hosts these monthly Let's Talk Your Health webinars. By providing important education on common health conditions and ways to protect your health, we hope you'll be able to improve your overall well-being. Now, in this installment, we'll be discussing lung health. The lungs are vital for keeping us alive. With every breath we take, they provide oxygen to the body and remove carbon dioxide. Unfortunately, poor lung health is extremely common. In the U.S., more than 35 million people have chronic lung disease like asthma or chronic obstructive pulmonary disease, according to the CDC, with lung disease a leading cause of death, claiming the lives of nearly 600,000 Americans annually. So to learn more about the importance of our lungs and how to protect them, we're joined by Juan Antonio Barajas, a local nurse practitioner. Thank you, Juan Antonio, for joining us today.
Thank you.
Now, you are a nurse practitioner. You've been a nurse practitioner for 5 years, but before that, you worked 15 years in the ER and ICU settings in local hospitals here in the Valley. Tell us, how common is lung disease here?
Lung disease is very common. That's what we see the majority of the time, because we have very young kids coming in versus also adults, and especially in this area, we have a lot of chronic diseases. Before it used to be winter Texans, now just regular people, especially now that vaping is very common. That's what we've seen a lot.
I know when we talk about lung disease, we always talk about people over the age of 65 or children like under the age of 2, where they would get some of those issues that you would see, like the whooping cough or the pneumonia for older adults. But with this vaping, with smoking, are you starting to see those younger adults are also coming in now?
Yes, teenagers, even 11 and 12, they come in with a lot of like respiratory problems, also very sick. Some of them even because those vapes have a lot of chemicals, and sometimes it causes altered mental statuses and other things like that. So,
now, compared to vaping and smoking, which one have you noticed has been more impactful on a person's health?
I would say both. I can't say just one or the other. I know vaping, for the younger people and for the older would be more.
The threat of lung cancer that you see, but you can also get lung cancer with vaping.
Yes, you can.
So people need to be very aware that vaping is a dangerous choice to make.
Yes, because those chemicals they have, it's even worse than the nicotine itself.
And when they come into the ER, are they in respiratory distress for the most part?
Yes, when they come to the ER, they're already been in respiratory distress for a while. They come in and they just, they're basically wheezing, and they come directly into the ER. Sometimes they try to triage the patient inside because the patient's really bad. A lot of patients, especially the older patients, they come in with pneumonia, and that causes a problem for them. So they come in really quick, and we have to start up nebulizers and start antibiotics and right away get them in, because they're pretty much going to respiratory distress, and then they have to intubate, and that sometimes the worst case scenario. Yes, and then with the young kids too as well, because they think they're not used to going to the ER. They're just they're supposed to be young and healthy. And then we also have the children who are autoimmune diseases and other things that other external factors causes them to come in, like you say, like asthma, and those kind of things.
And with these patients that come in, the treatment, I assume, when you're seeing them in the ER, you work now as a hospitalist. You come to STHS hospitals and you admit patients. And you had told me before we started the webinar that the majority of the patients that you see are dealing with some sort of serious respiratory issue. So it's important to start them right away on those treatments, that you were talking about, the nebulizer and all of that antibiotic.
Yes, and even before that, prevention is the best way of doing this, because before the person coming into the hospital or to the clinic or to the doctor's office, prevention would help a lot, especially before getting it worse.
And understanding the warning signs and symptoms before they get really bad, so that you can treat it in a clinic setting versus an ER setting.
Yes, because when they go to the hospital, they're already been sick for a while. A lot of them come in. They're like, no, I was fine and everything, but they're coughing up a lung, and they're literally needing to come in to be treated, and then they stay 2 or 3 days or even worse. And a lot of times it's also fluid overload, especially the chronic diseases with congestive heart failure mixed in with a COPD and all those. It causes a lot of problems with the pneumonia as well.
Well, education is key. We have to educate ourselves about chronic conditions like lung disease, and you have a great presentation for us that will hopefully have us very knowledgeable when it comes to our lung health.
Okay, all right.
Let's get started.
Okay, all righty. Let's talk about lung health. Okay, just a quick rundown, especially with the lungs. The right lung, there's 3 lobes. Okay, and then the left lung is a little bit smaller because the left lung has where the heart's at, so it's it has 2 lobes in there. What do lungs do? Basically, they filter. They filter what comes in, like you said in the beginning. It brings in the oxygen, it lets out the carbon dioxide. It basically you breathe there. So a lot of your protectiveness is with the small hairs of the nose and the linings. It helps prevent you from having an infection. Now, we talked about prevention. I always have to say that you have to one of the best sources to wash your hands. Washing your hands, because you touch things here and there, and then you go in there and you like wipe your nose and wipe your mouth and everything, and then all that it gets into your lungs. The other thing is aspiration pneumonia. That's one that's very common in the hospitals, because as people get older, they tend to swallow things and they go the wrong way, and then their swallowing gets difficulty swallowing, and then you start having those problems. Common lung conditions. There's a lot, of course, but let's just run down the most common one. Asthma, especially for children, it's one of the leading causes, of respiratory failure, respiratory distress, and that causes problems. You have COVID-19. COVID-19 is still around, just like the flu. I see a lot of COVID-19 patients, RSV patients as well. We see those very common, but it's not like since like when 2020 first arrived, everybody was dying around. Now it's just yes, still people who are older, they are more at risk to have higher mortality rate. Flu vaccine, flus. The prevention is, of course, flu vaccine is very common as well. Pneumonia, like I said before, there's aspiration pneumonia, hospital-acquired pneumonia, those kind of things that happen there. Then you have the chronic diseases, which is COPD. COPD and emphysema, we see a lot of those. They're coming in because they've had it for a while. Okay. And tuberculosis, since we're part of here, we're close to Mexico, we see a lot of tuberculosis as well. Who is most risk for respiratory issues. The higher risk is older adults, greater than 65. Their immune systems are a little bit lower. They tend to be, they tend to get sick, and then a lot of times a lot of them don't have rides. A lot of them, they're older people, so they tend to get that. Younger kids, less than 2 years old, even 5 and lower. But I think like around 2 years old around there, especially babies, people who come in, like especially if they have a cough or something, they can get the child sick. I've seen a lot of cases with pneumonia. People with conditions, autoimmune diseases, not just autoimmune diseases, but just their immune system's low. People with cancer. A lot of people with cancer, they tend to get the pneumonias after they get the chemotherapy, done. Pregnant women as well, and people with disabilities. Warning signs and symptoms of lung disease. Of course, you have the shortness of breath. You have difficulty breathing, the chest pain. Sometimes the chest pain is the inflammation that they have, and so they start feeling like, oh my God, I'm having chest pain. And so the middle adult to older adult, they tend to have that problem. Mucus, cough, congestion, the simple things just like a flu, and just having somebody like somebody with bronchitis, fatigue, wheezing. Then you start having fever. When you start having fever, that's a telltale sign of pneumonia, that your infection is getting worse. And swelling of ankles and feet, it can be also respiratory issues because of the sometimes you get congestive heart failure. Fluid builds up. You also have pleural effusion as well, especially people with congestive heart failure. Common tests and diagnosis of lung issues. Okay, so of course the first one is like everybody is, if you're a nurse or you're somebody who's assessing a person, they tend to check with a stethoscope and find out to see where you have your lung sounds. If you have there's different type of lung sounds that us as professionals realize, okay, this patient has a pneumonia, patient has the crackles and that kind of thing. And then the respirations. If you're breathing very, very fast, those people are having difficulty breathing. You have a pulse oximeter. You can buy them now at Walgreens. Just check that out. And the other ones, if people who are who already have the chronic conditions, they have pulmonary function tests. They have those exams to identify what kind of what they have, what's the progression and those kind of things. Then you have also the diagnostics in related to X-rays, CT scans. Those are very, very useful. We do the X-rays and at first to identify something that we compare, what the lungs look like before, if the patient was there before, and see like, okay, this patient does have this. And also CT scans are more thorough. Ultrasounds we do a lot, especially with we find fluid, and we try to find out if they have fluid under the lungs. Okay, what are common treatments for lung conditions? Well, inhalers. We have inhalers. We have nebulizers. Nebulizers we use a lot, especially at the hospitals. Albuterol, Atrovent. We use those kind of things. So that does help. Help out, especially when somebody is going to respiratory distress. If you're at home and it happens, you have your, if you have asthma or you have those little pumps, that you breathe in there. Then you go into the steroids. You start going to the steroids to kind of help with the inflammation. Then you have antibiotics. Antibiotics we use a lot at the hospital. When we admit somebody, we start the patient on specific type of antibiotics. Okay. Also mucolytics for the mucus thinners. That happens especially when you have a lot of phlegm. And then of course we have oxygen that we check. We do also there. I forgot to say about doing ABGs, especially in the hospital. They give ABG, especially when somebody comes in with respiratory distress. And then also, like we talk about prevention. Prevention is a key. Washing your hands, being up to date with your vaccines. Always a flu vaccine. You have to have the flu vaccine, especially for young children going up to adult. And then the pneumonia vaccine after 65. What can I do to keep my lungs healthy? Okay, first thing you do, you stop smoking and vaping. That's the biggest thing. Even though you say, oh, I'm already smoking or whatever, and I know it's difficult, but stop putting, carcinogens, things that are bad, toxic toxic things in your lungs, because that will affect your breathing, and that can actually increase your chances of having pneumonia, COPD, and other things. The other thing is maintain a healthy weight. Exercise, like we discussed before here about having lung expansion, walking daily. You don't have to be a triathlon or work, or do anything like that. Just walk 30 minutes a day, which really helps. And eating right foods. The other thing is staying away from allergens. If you have allergies, you stay away from allergies. The things that cause the allergies. So including some foods. I mean, some of us are allergic to everything, and so we have to stay away from those things. Environmental factors. We talked about asbestos and those kind of things. Just stay away from those places. Stay hydrated. Like I said, wash your hands, and getting away from the sick. If somebody is sick, if you're sick, stay away from people. If you see somebody sick, stay away from them. You know what I mean? It's good for them to have downtime and get better. What preventative care can I practice to protect my lung health? Okay, you stay up to date with your immunization. Good hygiene. Take steps for cleaner air where you work. When sick, stay home and seek health care. Right now, if you cannot afford certain health care, there's places where they're Clínica de Valle, and places that you pay cash, but at least you'll be able to get yourself an antibiotic to prevent it getting worse, because it will get worse. You cannot just ride it. For individuals seeking to improve their lung health, there are numerous resources available. American Lung Association, okay, NHLBI, NIH, okay.
Yeah, that is some great information. We're going to go into more detail now. So drink your water, because we're going to ask you some questions here. So we were talking about those common lung conditions. So asthma is one that we hear a lot about in children, but asthma follows you into adulthood, right? So you're going to have to make sure that you're paying attention to those triggers as an adult as well.
Yes.
Do you see a lot of people with asthma coming into the ER because maybe they weren't thinking that they needed to have their inhaler nearby, and all of a sudden they started facing an issue?
Yes, and it's not just that. There's a lot of environmental things, because a lot of people are allergic to cleaners, to certain things that cause it. And there might be walking somewhere, and that aroma of a bleach or something can cause somebody to have that. There's certain type of biologics that they start using, especially when you get older, like biologics like Dupixent and other things that kind of help reduce that effect. And there's other treatments as well for that.
Now let's talk about bronchitis. It's something that we hear a lot about. What's the difference between bronchitis and pneumonia, which we also hear a lot about?
Okay, well, both are, they're triggers. Like the bronchitis, it causes inflammation. It can be from any kind of source of allergen. It can be anything. Pneumonia is a bacterial infection that can go into the lungs and cause inflammation as well. So
and bronchitis, you can get at any age.
Yes.
And same thing with pneumonia.
Yes, and when it comes to children, the bronchiolitis, because they're a lot smaller, so you get that more prominent. And then as you get older, you get bronchitis.
And now pneumonia is one that sounds like, oh, it's not just a common cold. Pneumonia is a serious issue. Diane Keaton recently passed away of pneumonia, is what the medical records showed.
Yes.
So it's something that we really need to take seriously as soon as we start feeling something, because it can lead to pneumonia, right?
Yes, you need to get treated. It doesn't mean that you have to take antibiotics. What I mean, you need to get treated as you have to go seek a doctor, because sometimes they require something to kind of reduce the inflammation and those kind of things.
And how does it lead up to pneumonia? At what point, did you wait too long?
Well, yeah, because when you wait too long, because a lot of things lead to pneumonia, especially in older adults when their swallowing has failed. They start eating things and it starts going to the wrong side. They start coughing, whatever, and then it gets little by little. It starts producing it. When you've gone too far is when you got a fever. When you're basically started having the weakness, it's like having the flu.
And what are the telltale signs that you could be at risk for pneumonia? Like, what's the first three things that you would tell a person? These are the three things to look out for to make sure you go and get help right away.
Okay, so basically the fever, like I say, fever is one thing. The other thing is when you start having a cough and congestion, and it's not leading it just occurred, or it takes a little bit of sometimes it goes fast, sometimes it goes slow. So you can't say it because sometimes it depends between a virus versus a bacterial. So you just have to know that if you start having cough and phlegm and everything, go seek out because you might have an upper respiratory infection before it becomes a pneumonia.
Okay, and then let's talk about respiratory syncytial virus. So RSV is something that we hear a lot about. I know that the children get it, and you hear about it during the winter months, but older adults are also at risk for RSV, and I believe there's an immunization now that they can get.
Yes.
So why do we have to be so careful, especially as older adults, when it comes to RSV?
Because it's a virus, so it can get worse. You can start having that symptoms, and it's very difficult to get rid of because it's very contagious as well. You can give it to to your family, to your children. It's just a contagious thing.
And all of these basically spread by droplets, right?
Yes.
So that's why the hand washing is so important, paying attention to touching surfaces.
Yes.
And I am notorious for touching my face. I know I'm not supposed to, but it's one of those things that if you're not paying attention, you're doing this often and you're just putting yourself at risk. So making sure that you have clean surfaces, washing your hands, and staying away from anybody who's coughing, sneezing.
Yes, hand washing is very important. That's the step one to prevent pneumonia, to prevent any kind of upper respiratory disease. Because you have those anywhere. If you notice, like anytime you get an infection, there's always an opening, a wound, the
your
mouth,
eyes,
the
your
ears,
nose, your
anything that's
Yes.
opening, you will get an infection because bacteria loves certain things and they will get there. And there's different types. There's fungal. There's so many different things. I mean, it's a long array of infections that we could do. I know you say pneumonia, but there's so many.
Yeah.
It just the main thing here is prevention.
And we talked about tuberculosis. It's still a serious issue here in the Valley because I know that at STHS, when you get hired, you have to do a TB test because obviously we're in the hospital setting.
Yes.
Is this something that we're still seeing today? Because we used to hear about TB 10, 15, 20 years ago.
We still do. I mean, we always have to rule it out. Because some people do get it, and there's also false positives because of because we're close to the border. But then also you have people who are not taking care of themselves. They live close to the border, and they do get it. I mean, young kids, even adults, they do. I still see it coming.
And then we hear about COPD a lot, and there are millions of Americans who have it. I believe it's about 11 to 14 million Americans who have COPD. Tell us a little bit about the signs of COPD that we should be looking out for. Okay. Are they similar issues that you may see, the coughing,
yes,
the fever?
Like difficulty breathing when you're walking around. You start. Well, of course, you have some people get the barrel chest. Some people get they start having. Because there's multiple diseases that can cause that too as well.
Yes.
But you start having the shortness of breath, and it gets worse, and you can it gets to the point where you start sitting up in bed and you can't breathe laying down. That's when you know you have even worse. But there's also a lot of prevention, like I say, just to keep seeking your doctor's advice, especially if you start having difficulty breathing.
All right, and then lung cancer is one that obviously affects millions of Americans. Let's talk a little bit about lung cancer. Can you get lung cancer and be a non-smoker?
Yes.
So tell us about the risk and the danger of lung cancer.
Okay, well, sometimes it's there's markers. So you got heredity.
Okay.
So there's
the
other
genetics play a role.
Genetics. A lot of cancers they start from other places, and then once they start getting into the lungs, that's when you start noticing that because you see that little patch there in the X-ray. A lot of it, like smoking, that causes cancer. It just does. Vaping, of course, does as well. Things that go into the lungs, even working with asbestos, working with different type of chemicals, you will get for long exposure, you will get cancer. So try to prevent the environmental part. Do as best as you can. If you have a job that does that, use a respirator. There's ways of preventing you to do that. And I've seen people, I've seen people from all walks of life get cancer. And you know, sometimes you can't not that you can prevent it, but you have to be aware of what it is.
Yeah, you have to be aware of your surroundings and protect yourself at all times.
Yes.
Tell us, when it comes to lung cancer, what are some of the signs and symptoms? Are you able to detect it early, like where you can kind of notice it? You know, like with breast cancer, you may feel a lump. A mammogram obviously will tell you sooner than that, up to 2 to 3 years before you can even feel a lump. Is there something that we can do to detect lung cancer earlier? I know that there's a screening that McAllen offers at STHS McAllen that you can do just to make sure if you have a family history.
Yes, a family history. There's certain markers that you can do first. Like if you already know that your family, your dad, your uncle, and everything, you know, genetics, you're gonna have to get tested first. And if you come out positive, then that's when you start getting X-rays and just, you know, X-rays is always the first part, just to check it out. Yeah, I don't think you need to do a CT right away, but just, you know, just to do that. If they find like a little dot or something, then they can check that out, and they could do a biopsy or do whatever, you know, they do.
But
so,
these are conversations that you should be having with your doctor, who you should be seeing regularly, at least once a year or more if you have more chronic conditions that you're dealing with.
Yes, and that's what you would do. You know.
Can lung damage be reversed?
Well, no. Lung
if
damage,
you had like a little bit of lung damage, maybe or something, can you reverse it with rehab or like, you know, pulmonary rehab?
You can improve your lung function.
Okay.
That you can. That's why we do pulmonary function, you know, test, just to kind of improve it. Because I've seen people with almost zero come back to like maybe 30 or 40%. I mean, it's not going to be 100%.
Yes.
But your lungs can recuperate, and you can breathe better. But not all diseases, because I'm just talking about there's some that just is to the point where once you get it done, it's, you know,
it's done.
There's like, you know, you have like certain chronic conditions that you can't, but you do try with certain medications. There's certain medications that pulmonologists are specifying. I'm not aware of all of them, but I know that they do those medications, like, you know, they do tirelessly, they do, and it does improve lung function. So you will have lung function.
So you may improve lung function, but you're never going to truly remove any damage that you've done to it.
No, I mean it heals, but it's already damaged.
Yes,
it heals.
So that's why it's really important that we protect our lung health. Now, do allergies harm the lungs? I suffer from allergies, and I take a daily Zyrtec to avoid any issues. But can allergies affect our lungs?
Yes, they do affect your lungs. Like I said before, the allergies in the beginning, I was saying, like, you know, allergies can cause, you know, an exacerbation. It can cause a reaction to your lungs to, you know, to cough and to, you know, to do that. If you're exposed for a long period of time, you can get into a reaction, a serious reaction. And some kids, like I say, asthma, you know, that's one of the biggest ones. They get, because something causes it, and then they start breathing and having difficulty breathing.
All right, let's talk about masks. I know that there's a lot of controversy, especially during the COVID-19 era, that mask and people not wanting to mask. But how important is it to mask if you are ill or if you're going to be around somebody who's ill?
Well, of course, mask and wash your hands. I mean, it does help, because, you know, the droplets, they do cause infection. Like, I've seen people do the and then they just go and just like,
you just did that right now.
Yeah, and then do that, and so that causes a lot of, you know, problems, because if I'm sick or anything, like I have a cough, I pretend not to, but then I still cough, and I see a lot of people do that, and it's just something that we need to prevent.
So if we are living with a lung issue, let's say we have COPD, and that we're living with daily, should we mask?
Well, that depends. I know some people who do wear the mask, especially that they have chronic conditions. They try to prevent, when your immune system's low, you do put that on there, because other people might be sick, and they might be in you know, around you. So it's best just to kind of like protect yourself.
Especially if you're going to be traveling or in confined spaces.
Yes.
Anywhere where you don't have that 6-foot distance that they used to recommend during COVID.
Yes. And so, I mean, I would wear like a mask if I was sick, or if like I was going somewhere like very contained. But I've, you know, like I said, I never worn a mask in a while, but, you know, but, you know, somebody who has a chronic condition, I would recommend if they're bound to get sick, or they get sick really easily.
I lived in Asia for 8 years, and it was incredible to see that people wore masks. There was no controversy around it. If you were ill, weren't feeling well, you wore a mask, or if you knew you were going to be around somebody who was ill, you wore a mask, and nobody said anything about it. And it's just a way to protect your health. So don't necessarily let the stigma surrounding masks influence your health, right?
Yes. I mean, you have a right to wear a mask if you want to. Some kids even wear masks at school because they don't want to get sick. So that's, that's okay.
All right, now let's talk about those risk factors again. So people who are over the age of 65 or older are at greater risk for lung issues. Tell us about, as we get older, obviously our health declines slightly. Our lungs aren't as healthy as they used to be, so it just puts us at greater risk.
Yes, okay, your immune system, like, it lowers. I mean, not every older adult is ill, but just certain factors, they do cause that. So as you get older, of course, everything, I'm not saying everything goes downhill, but you tend to require more help with the physicians, with the doctors to come help you out, and, like to get you to, in healthiness, being healthy, like, eating right, weight. That's another thing too. Especially obesity is very common. When COVID hit, we saw all these people who are very, very heavy set get sick right away, and so that's what causes it, like a lot of the unhealthy, other chronic conditions.
That's why we have to maintain a healthy weight.
Yes.
All right, and then with those risk factors, also we're dealing with anyone who has a weakened immune system. So if you have a chronic condition that impacts your immune system at all, or if you're ill, make sure that you understand that you are at greater risk for any sort of lung issue.
Yes, and it's kind of hard, especially the ones who are really sick. They have their immune systems are low because they have certain diseases, like that kind of thing. They have to go to their primary doctors. A lot of them can't take the flu vaccine. A lot of them can't do that. So there's other things that they have to require to do to help to prevent them from getting sick.
And one that surprised me was being hospitalized. Obviously, you go into the hospital and you're cared for, but you are around other sick people, so you could feasibly catch pneumonia or an issue like that. So you need to avoid going to the hospital at all, right? So you should really be protecting your health so that you don't end up in the hospital. As soon as you, at first sign of something, talk to your doctor and try to see so that you don't end up putting yourself at risk.
Yes, it's not that we don't want you there, as in we don't want you there, because we don't want somebody to, not just because they get sick, but it's just, you can prevent, all this can be prevented. Of course, sometimes there's a condition that, pneumonia hits or upper respiratory happens. I mean, you're gonna get ill. People do get ill, but we can be treated outside, and that's the best way. Going to, like, if you don't have a clinic or whatever, there's certain hospitals out, like the satellite hospitals, like they can just take care of the urgent cares. Those kind of things. So.
Yes. And then now let's go into the warning signs. So a chronic cough, like what makes a chronic cough? What is something that should concern us if a cough is lasting longer than how many days?
Okay, if you start having more than 3 days and you keep coughing and it's getting worse and you have trouble breathing, then that's when I would seek attention.
Okay.
Because I mean, if you have the cough and when you have that cough, it's like you eat something wrong, you start coughing. Well, imagine that, 100 times. I would get some help right away. I wouldn't last a day like that. I would just go right away to the doctor, have a mask on, of course, if you're coughing like crazy, and so they can give you something to kind of help that, because it might be something very simple, or it might be something very, something very, very serious.
Now, one of the risk factors is, or warning signs, is shortness of breath.
Yes.
So obviously, shortness of breath can be a little bit confusing because you may confuse it with somebody who may be out of shape, going up some stairs, and you may be a little bit short of breath like you weren't before. So when is shortness of breath a concern? Like, what are some of the signs that it's something beyond maybe you're just not as physically fit as you used to be? Okay,
well, if you're shortness of breath just by any activity, then yes, I would go to the doctor, because it might not be a respiratory problem, it might be a heart problem. So you do have to check it out, because if you let it go, you're going to be the one you're going to stay more longer in the hospital than anything else. So rather just go to a doctor and just they could treat you, or they say, go to the hospital and they take care of it. They diagnose it, and then from there you can go.
All right. Now, chronic mucus production. So if you have a lot of mucus and you're dealing with a lot of it and often, that's one of those warning signs that you really need to go and talk to somebody.
Yes. Yeah, because there's different colors of mucus. I mean, you can have the clear mucus, which we always have. It's normal to have mucus. I mean, we're human beings. But when it starts getting thicker and thicker and greener and different, you have all these funny colors. Every single color has a different meaning for what it is. So we have to kind of like, take care of it right away.
Mm-hmm. I imagine you have a chart and you're like, okay, it's brown. Okay, there may be some blood in that. Let's look for this, this, and this.
Yes,
so when you're looking at it as a physician, as a healthcare professional, you're looking at it and you're saying, okay, this is the color. Let's go with this.
Yes.
It's crazy to think about that. Now, wheezing is that noisy breathing or wheezing sign is something that you should be looking out for.
Yes, when you have that wheezing sign, there's something going on there. Your lungs are having trouble breathing. There's something in there. There's some phlegm, some mucus. There's some liquid. It could be pleural effusion, so you have difficulty breathing. So all those cases can cause you have to go right away to the doctor, so they can take care of that.
All right.
Because just a nebulizer can resolve it, or if it's more serious, if they do an X-ray and they find that there's fluid in the pleural area. Then you would have to get that removed or get on a certain pill.
All right. And then coughing up blood is one that should be very obvious. If you are coughing up blood, that's definitely a sign to go to the doctor.
Yes, because it could be a foreign body. It could be multiple things like TB as well. It could be other kind of esophageal issues. It can be various things. So you do have to kind of like go right away, because if you're coughing that way, it's either you're having an infection and you let it go. I've seen that before, versus TB and also of course other conditions.
And then the last one is the chronic chest pain, which it's unexplained chest pain that lasts for a month or more, especially if it gets worse when you breathe in or cough.
Yes.
So
the inflammation.
Yeah.
That's what causes it. So if you have chest pain, like let's say you have the chest pain, especially in the back area, and you're sitting down, you're like that. Of course, it could be muscle, but it's mostly it has to be, if you start coughing and it hurts, that means you have a really serious lung infection.
And then when you're listening, so a patient comes in and you're listening to the sounds, what is crackling versus wheezing versus that high-pitched noise that you're listening for? What are those differences that you might listen to and hear yourself when you're getting ready for bed or something, or hear it on a loved one? You're like, that sound doesn't sound well.
So just think about it. If you have a sound, any kind of sound, if you have a sound, and it's like a lot of times some people have these little crackling kind of things. But if they're an older person, they have for a long time they've had it. It's a long-term condition. But if you're somebody, even if you're older, you never had any issues like that, and you start hearing any noises, it's good to go to the doctor, because it can be a restrictive a restrictive disease as well.
Oh wow.
Yeah.
Yeah, so you got to be paying real close attention to those sounds. I know every now and then I'm like, wait, that didn't sound right. But it doesn't last very long, but you're just like, wait, did I do that? And so
because not everybody has a stethoscope or they can do it. I mean, you can do that and you can try, but I mean, it's when somebody you're there at home and you're coughing and you start feeling like that, or even a wheeze. If it's a wheeze, there's something you really need to go to the doctor.
Yeah.
So they can give you something, Okay.
All right, let's talk a few facts and fallacies when it comes to breathing easy. So family history factors into the likelihood of developing a respiratory illness. Is that true? Family history.
Well, not quite. There's certain, of course, conditions that are genetic, but I mean, the majority of the time, you just, if you have a family that smokes and everything, you're gonna get, those things. And
when we talk about smoking, you're also talking about the secondhand exposure to smoke. So you could not be a smoker, but you could be around somebody for 20 years who's a smoker, and they're smoking in the car or wherever you are, and they're impacting your lungs.
Yes, and then cancer, cancer is, of course, genetic. I mean, it can be genetic, so that's why you have to kind of be watching out, because that it can be true with that part. But
can acid reflux be a cause of a chronic cough?
Yes, it can.
So you may be dealing with something that's a little bit more gastrointestinal versus the lung.
Yeah, but it could affect especially this area here, in the esophagus and everything, because of erosion. It causes erosion, then it causes bleeding, then you can cough. with a long gastric reflux.
This one I know is definitely false. Smoking won't kill me or anyone else.
Of course.
That one is an easy one to answer.
Yeah.
So smoking is dangerous. We got to stay
smoking
away
is
from the
dangerous. Doesn't
smoking.
matter what kind of smoking it is. It's dangerous. It's you're inviting different toxins into your body. In any part, in your lips or whatever, it's smoking. It just causes a lot of problems.
True or false? The symptoms of lung cancer are obvious.
No.
Sometimes you may not know that you're walking around with lung cancer until you get that screening or
it could be a small little patch and everything, but it depends on you catch it when it's starting to cause problems, or some people get detected without even with other issues, and so you have a patch, and so then we have to investigate that.
All right, and the last one is you can take action today to improve your lung health. You're never too old or too young to protect your lungs.
Yes, by going to your doctor periodically, especially if you have a chronic condition, versus just if you get some sort of infection or something, just go to the doctor, and so they can give you some of that. The issue that we have now, we have of course we're in the internet right now. There's Google doctors out there. And then there's AI doctors too. Now there's AI doctors, and they right away they come up and tell you, they come to you, I have this. I'm like, well, hold on, we're here to investigate. Let's do all this labs and everything. I'm never rude, because they are trying to tell you, hey, I have something going on.
Yeah.
But now a lot of people there's the people who do that, they go to the doctor and tell you that, versus the ones who get Google and then they stay at home and they go, no, it's got to be this and that. I'll get this, I'll get that, and they self-medicate themselves, and then they get sicker.
Yeah.
And then they come with a lot of other problems.
See, the problem when I do Dr. WebMD is that he tells me the worst case scenario, and that's the one I see and I get paranoid. So it's always better to trust your real life doctor, have a primary care provider that you trust, that knows you well, that you have a good relationship, and so has tracked you over years and says, you know what, it's actually not as bad as it looks, because sometimes you think the worst case scenario.
Yes, and you just gotta, it's maintenance, like a car. You go in to get maintenance, you get an oil change and everything. You have to go to a doctor to make sure you got a yearly exam, make sure everything's okay. And it's not always going to a doctor when you're sick. Just mostly making sure you get everything covered. Especially as you get older, your doctor has to be your best friend.
Yes, so, he becomes he's on speed dial.
Yes,
and you're like, I need your cell phone number, not just your office number.
Yes,
that way I can text you.
Exactly.
So let's talk a little bit about preventing lung issues. So one of the keys is getting vaccinated.
Yes.
So making sure that you're up to date on your vaccination. So which ones, especially if you're getting to the age of 65 and older, which vaccinations are a must?
Okay, the flu and the pneumonia vaccine. Those are the basic ones. There's a lot of controversy with the COVID one as well. I mean, I got the COVID a while back, but it's more the pneumonia and the flu. That's the one that I would just completely get. And then of course there's other adult things like meningococcal,
like RSV if you may need.
Yes,
or,
the RSV as well.
Yeah,
so then that's when you start doing that. But I always say pneumonia, and those are the main ones.
Now there's a lot of there's a lot of misinformation when it comes to the vaccines, and some people believe that if I get the flu shot, I'm going to get the flu. You're basically giving me the flu by getting the flu shot, but that isn't the case, right?
No, it actually helps prevent it. I mean, some people, they do get the sniffles here, they get some reaction, but I mean, it goes over in a day. All you do is take Tylenol, just like our kids. We get immunized. They're very essential, especially a lot of people they're non-vaxxers, and they cause more problems, and they cause problems in the community because they get sick for those conditions that we already eradicated. So when it comes to the flu and the pneumonia, it does help. We just may get a little bit of Tylenol, and you'll be okay the next day. Like I don't get any reaction to it at all. I get everything. But, so.
Yeah, so I will give you an example. I get the flu shot every year. It's required for work, but I've always gotten the flu shot, and I always get it in early September, like right like clockwork. As soon as it's available,
available,
I get it. And so I was really busy in the month of September, and I just kind of missed it. And then I started getting sick. And I was like, well, I don't know if I should get the shot right now when I'm feeling a little under the weather. I wasn't really sick, but I was just not at my best, right? So I was like, I don't know if I should. So I waited a few days. Well, once I got it, I felt so much better. I was like, did it really just kill it that quickly? Like whatever I had, what remnants of whatever I had were gone.
Yeah, well, like, I think the
I don't know if I was getting over it or if it was just my mind telling me.
You probably got over it, but because it might not be a flu, it might be something else that might get in there. But I think that just as long as you keep yourself up to date, you don't have to worry about that. You can, but there's some people, like I said, they cannot get the flu vaccine, but they know they know because their doctor tells them you can't, and they give them other alternatives. They give other things.
So speak with your doctor just to make sure if the flu shot, if the influenza shot is right for you. If not, here are some other options that you can take.
And children, they have to get immunized. They have to. They have to be up to date. I mean, there's a lot of programs that help with the kids. We don't want our kids to get sick, especially they get sick a lot, especially before 5. But they're always getting sick, especially going to the daycare and everything. But
so making sure that you're definitely up to date on all the vaccines. So the next one, to protect your lungs, don't smoke. And we cannot stress this enough: the dangers of smoking.
Yes. Smoking's, like I say, it introduces something into your lungs, and it's not good. A lot of people who, like I said, the older adults, they smoked before. I mean, it was common to be smoking at that time, but now they're living with the problems. And a lot of them, I know, they already quit smoking and they're doing okay. They still have the chronic conditions, but they're doing okay.
Yeah.
And just, and anytime they get into something like some sort of, like any kind of smoke smell and everything, they get sick, so they try to stay away from that. And then, like I said, the kids vapes.
And vaping, that was going to be my next one.
I see so many young kids come into the hospital, with vape issues, with pulmonary problems and everything because of that, and they get really sick.
What does vaping do to the lungs?
It's just like the smoking, but it introduces different chemicals. I don't know exactly the type of chemicals, but I know there's chemicals that don't belong in your lungs. Yeah,
because I've heard of popcorn lung. What is popcorn lung when it comes to vaping?
Okay, so it's like when you have the lungs, they start having the little, I can't explain, the little. It's
like kernels of popcorn. It looks like popcorn. Is that
yeah. When you take an X-ray, it just shows the differences, like how it starts having a different form because you're damaging the lungs. And the areolas they start to form funny. Yeah. So.
And vaping, does it put you at more risk for like pneumonia?
Yes.
So that's something that you really need to think about.
Yes, because you're giving, like I say, you're giving carcinogens in there. Like I can't tell you what kind of chemicals in there because they tell me the chemicals, but I mean I don't know if it's true or not. So I mean I don't research the vapes itself.
Yeah, but the most important thing is to understand, because you should not be going into an ER as a 15, 16, 17-year-old with lung issues. That is definitely not something that you should be going in for.
Yes.
And I think there's the misconception that it's not smoking, so it's not the same, but you're using the same chemicals just in a different way.
Yes.
Or similar chemicals.
Yes. Well, I think it's different chemicals. Like the cigarette smoke, they do have some sort of carcinogens, but the chemicals that they have in the vape, there's stuff like formaldehyde and other stuff that's just really, really bad stuff. Why have it in there? I don't know. So.
All right, another one is to avoid exposure to air pollutants that can damage your lungs. So we'll talk about indoor air quality. So the air in our homes is really important. If you're not dusting often, things like that, you got to make sure that your home has good air quality, right?
Yes, especially if you have pets. You do have to keep the pets, groomed. You have to, sweep up every day. You have to make sure that because there's dust and everything, all that stuff goes in, and poor air quality can happen. Like whenever we're talking about allergies, there's a lot of dust, not just dust, but also other kind of things, pet dander, cockroach as well. Not everybody lives in like in a model home, and they tend to have those kind of things, and cats, cat poop, dog poop, all that stuff gets, it can get into the lungs.
So an air purifier may be a good idea if you live with somebody who has lung issues, or yourself, you may be dealing with some stuff. Yeah. It might be good to invest in an air purifier. Yes, and
I do that. I do order that to some of the patients who have that problem, especially with a lot of allergies. I give a purifier. Also, getting your vents cleaned. There's a new thing that the people do now just to clean the air ducts as well. The other thing is the air conditioner filter. Just change it. I change mine monthly.
Monthly.
Well, they say some people do it every 2 weeks, but if you have a really dirty place, you do it every 2 weeks. But I do it every month. This monthly.
And you can totally tell as soon as you take it out, it really needed it. You can see everything that it was capturing, and you can only imagine what it wasn't capturing if you see as much as you see.
Yes.
So you got to be really careful. And then let's talk about outdoor air pollution, because that's also something we have to worry about, especially if you have asthma or allergies. You have to know those triggers and make sure that you protect yourself.
Yeah, you should know those triggers, because if you lived there for a while, you need to know that there's certain areas where you can't go to, because here in the valley it's a high pollen area. It's a high area, and it's not the cleanest air. So we have to kind of be really careful. I know there's other places that are worse, but I'm just saying that we have a high pollen area, so we do tend to get those triggers, and just make sure that you stay away from those areas that are high in pollutants.
And you can always visit weather.com, and you can look at the air quality every day for your region. You just type in your zip code, and you on that page will be able to see what the temperature is going to be, your chance of rain. As a former weather forecaster, I can tell you, and you're also able to see the air quality, and making sure that you're like, today I really shouldn't be overexerting myself. I shouldn't be gardening, or I shouldn't go for a walk, because right now the air quality isn't as good as it should be.
Yes, and sometimes you have to tell your patients, like, hey, like they say, I want to travel to Mexico City. I'm like, you can't,
yes.
because the air quality there is really bad. So it's like you have to say, you have to stay away from those areas.
And does weather impact your lung health? Like if the weather, if you're experiencing bad weather, extreme heat, or extreme cold, will that affect your lungs?
Yes, it will. Because high heat, high cold, it does causes problems, especially with the breathing. Because I would just have your mouth covered, with a scarf or something, especially because you're breathing something cold. It can cause it can cause a trigger. It can cause it can cause an increase of pressure.
Yeah, I remember living in New York and turning a corner during a windy day and just getting hit by a blast of cold air.
Yeah.
There's nothing that'll stop you in your tracks more than that really strong wind that just hits you. So you have to be really careful.
Because your body, just breathe. If you do your breath like that, it's warm. So another type of temperature, another thing can actually cause a lot of issues, especially if you have asthma and COPD.
Another thing you can do to protect your lung health is exercise. So we talk about the importance of exercise, obviously, for maintaining a healthy weight. There may be some people who say like, oh, but I can't do a lot of exercise because I have lung problems. But you can improve your lung function with exercise.
Yes, walking every day, because your lung perfusion, you're breathing in, you're breathing out much more. It's like you're exercising your lungs, not just your body.
Yes. So it's about building up that endurance that you need. You're strengthening your lungs. So people always tackle the beginning of the year when it comes to exercise, and I'm going to hit the gym hard. I'm going every day. And so they overcommit, and then they aren't able to. But it's basically baby steps, right? So
walking.
Just build yourself up with a little bit of walking. 30 minutes a day is all we really need.
Yeah. Some of us can't run. Some of us can walk. Some of us have to walk. Like some of us are big, and so we have to walk, like that. So that's what you got to do.
So 30 minutes of moderate, intense physical activity 5 days a week. 30 minutes, 5 days a week. That's 150 minutes a week that you need to do. It doesn't have to be formal exercise, as you said. Walking briskly, so going for a walk around the block. You can do some recreational bicycling, so you can ride a bike if you don't want to be walking. You can garden, so gardening is something that you can be doing because you're exerting yourself while moving. Or you can do this one, I'm sure my mother will appreciate, vigorous house cleaning.
Oh, wow.
You can be mopping, sweeping, as long as you're moving, right? It's all about just moving and getting that movement and exercising. And then aerobic exercise is also good, as well as muscle strengthening. So doing some strength training is also beneficial for the overall body.
Yes, yes, and it takes time, but you just got, like I just say, start off with walking, and you can start doing other things if you want, just to breathe, better.
But if you do have lung issues and you're going to start an exercise program, how important is it to talk to your doctor to make sure?
It's very important, because they'll tell you what you can and cannot do. Because a lot of people think that they can go in and they can do what they did when they were like 15 years old. And then they realize they go there, they're like, and they start having those breathing problems.
Yeah, you're not 25 anymore when you hit a certain age. And then when we're talking about exercise, you can also do breathing exercises. So there's a lot of great videos nowadays that you can see on YouTube. You have box breathing, you have pursed lip breathing. There's all these different breathing techniques that you can do to really just work on your lung function.
Yes.
You don't have to necessarily do physical necessarily, but you're just, as long as you're breathing. But doing those breathing exercises helps, right?
Yes. Exactly.
Are there any that you like to do?
Just deep breathing sometimes. Just deep and that is not just also for my lungs. It's just so I can calm down when I'm so stressed out. I'm like, and I just take a breath, and it does help. It does help. Do a couple of those, and your heart rate goes down, and you start breathing better, and your stress goes out. That's what I do sometimes.
Now we hear a lot about physical rehabilitation, occupational therapy, those kind of things.
Yes.
Pulmonary rehabilitation, what is that, and is it something that can help somebody who may be dealing with lung issues?
Yes. There's like cardiac and pulmonary, both of them.
Okay.
And I've seen it especially after a procedure, or for somebody who's had a lot of chronic lung problems. It's a range of physical and occupational therapy, but they specialize especially with endurance and the breathing, and also there's other machines that they use as well to kind of like breathe, help you breathe in and have that being like that with a machine. So
I've seen the one where you have the little ball and you're like basically
it's
like
IS,
the IS. That's the IS.
It's
so you're shooting it up or holding it up, trying to keep it up at a certain point.
Yes.
At what point? How long do you have to hold that for?
Well, not too long, because you have to do it like I tell my patients, like if they're watching TV, you do it every time, and then you do it every other minute, and just keep doing it, keep practicing every few minutes, and then stop, then go, and stop and go while you're awake, because that helps with the lungs.
All right, so having one of those at home is something you can.
It
will help.
It is, but you could also do it like by yourself, like breathing slowly, because you don't have to buy that thing. I wouldn't say to buy it. It's
but just work on the breathing in.
In the hospital, in the hospital, they use that a lot, especially after a surgery for lung expansion. Because a lot of times people don't want to breathe because they're in pain. They're all, and then it causes atelectasis and all that stuff.
So now you're going to see your doctor. You think you have some lung issues. What are the things that they should prepare for? What questions are you asking them? So that they know, like, okay, I want to make my notes of what obviously maybe like symptoms they need to be telling you about, or what do you want them to tell you? What makes the perfect patient coming in and telling you, this is what I'm dealing with?
Okay, basically why you're gonna go in there, like you say, you have like chronic condition or you're short of breath, just give them the symptoms that you have first. And then what they'll do is they'll do some diagnostic exams. If you're really sick, and as in you can't breathe very well, and it's because you have a chronic lung condition, then you will have to do a pulmonary function test to see where you're at, and then they'll prescribe with you the medications that you need for that. Then if you just say you want to get it better and extra, they'll tell you the exercise you can take. You can do brisk walks. You can do certain things that it depends on your age too. You can just
run a marathon.
Yeah, and run a marathon or bicycle ride. Certain things you can bicycle ride, but not like mountain biking or something. Like that. But you just have to ask what you can and cannot do. And what they'll do is they'll do a lot of prevention measures. Like, okay, well, you have to take these vaccines, and then they'll say these are for prevention, and that's how you would talk. So you write everything down, and especially to say, what, this is my concerns. I'm concerned because I sleep. When I sleep, I have to sit down when I sleep. I cannot lay down when I sleep. Or I walk only a few steps and I'm passing out. And I feel dizzy.
Okay.
And so you do have to kind of ask that, because it can be multiple things, especially with your primary doctor. Before they send you to a specialist, the specialists are dealing because you're already at a point where you require more assistance, and you require of somebody who knows more about the lungs, because I know the primary they're able to prescribe things for the lungs, but there's a certain point where you're just like, you know what, I need help, and like I need help with this patient. This patient is getting sicker. He requires this, or patient has lung cancer, and we have to get a lung doctor plus an oncologist together to kind of help take care of that.
So the important takeaway here is that you need a primary care physician. You need to see your doctor, build a relationship with them. When you come in for that first initial meeting with your doctor, you're going to be telling them all the issues that you have, any medical records you may have had from anything else, any hospital visits or anything. You should know when you got your vaccines, simple things that you can try to remember, so that way you can build that relationship with someone like yourself, right?
Yes, yeah, because you have to like get a rapport, because you're not gonna just come in. It's like, I'm telling you my whole story, and then the guy's like, okay, they already know you, they're getting to know you, and they're like, okay, let me see what I can do, because just saying that you have this is not gonna help. You have to have diagnostics and everything, labs and everything, so you can make sure that you're is not just saying, okay, it's this and then that's it. No, there's multiple diagnoses that can occur, so you have to make sure you got the right right diagnosis, and also for the person, if the person is not sick, and we try to prevent that from them getting sick.
Prevention is key.
Yes, prevention.
We want to prevent. That's going to be your big takeaway from today,
yes,
right?
Prevention.
Do anything you can to prevent or delay the onset of any lung issues.
Yes, exactly.
All right, high five on that one.
Yes.
Thank you so much, Juan Antonio. We really appreciate all the time that you spent with us today.
Thank you for inviting me.
All right. And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize your health and the health of your loved ones. We hope to see you for our next installment of this Let's Talk Your Health series on Tuesday, November 18th from 5:30 to 6:30 p.m. when we discuss bladder health. Like and follow the South Texas Health System Facebook page for details on our future Let's Talk webinars. And if you'd like to see our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health. At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.